Hello, ladies and gentlemen. I'm your host, Dylan, and welcome to the latest edition of So You Think You Know Med Micro, the game where you can win big cash with your knowledge of tiny organisms. Tonight's disease is dengue fever. Let's introduce tonight's contestants. We have with us tonight Olivia, Luke, and Forrest. Are you guys ready to get started?
All right, our first contestant, Olivia, what is your category?
Can I have etiology and transmission for 200?
You sure can. Name the pathogen of dengue fever and its characteristics. Forrest.
Flavivirus, which I believe is ssRNA and has an icosahedral capsid.
Correct. All right. All right, next contestant, Luke, what is your category?
Let's go etiology and transmission for 400, please.
All right. Etiology and transmission for 400. Where are you more likely to find dengue fever? Luke.
Tropical and subtropical areas.
Correct. All right, Forrest, your category?
The same category, let's go 600.
All right. Etiology and transmission for 600. How many stereotypes are there of dengue fever?
There's 4. It's DEN 1, 2, 3, and 4.
Correct. All right, Olivia, back to you. What is your category?
Same category for 800, please.
All right. Etiology and transmission for 800. What reservoir did this pathogen use? Olivia?
The dengue virus uses a human mosquito and a monkey mosquito cycle.
Correct.
The pathogen that enters the host for the dengue fever is directly into the blood by the bite of an infected mosquito. The attachment of the pathogen is to a mononuclear phagocyte. The virus avoids host defenses by intracellular pathogens that first avoid the antibodies and other immune system cells before eventually destroying these immune cells. The virus infects the monocytes and leads to the release of the kinins that produce the systematic features of the disease. The incubation period for dengue fever is typically 5 to 8 days, with the spectrum of the disease being from a non-specific viral syndrome to severe and fatal hemorrhagic disease. The symptoms of the dengue fever are sudden onset that lasts 2 to 7 days, severe headaches, bone and joint pain, weakness, anorexia, nausea, vomiting, and a rash. Dengue hemorrhagic fever is characterized by the normal dengue fever plus hemorrhagic manifestations, which are a tendency to bruise easily, bleeding nose or gums, and a possibly internal bleeding, which may lead to failure of the circulatory system and shock followed by death.
Olivia, you're next. What is your category?
I'll do diagnosis and treatment for 200.
All right, diagnosis for 200. Oh, looks like this is our daily double question. Olivia, how much are you going to wager?
Let's wager it all.
All right, risky. Diagnosis for 200. What are the issues with diagnosing dengue fever by clinical features?
Diet Dr. Pepper's really good.
Close, but that looks like it'd be incorrect. Looks like you lose all your points.
I'm out of here. Taking my Diet Dr. Pepper with me.
Okay. Luke, you're up next. What is your category?
Let's do diagnosis for 400, please.
For 400, what is the specimen used for lab test? Luke?
A blood serum sample is used as a specimen.
All right, that would be correct. All right, and Forrest.
Yeah.
So you're next. What's your category?
Let's go 600 for diagnosis.
Diagnosis for 600. What is the test that is used to diagnose dengue fever?
An indirect ELISA test is used to detect anti-dengue immunoglobulin M and IgG, as well as an indirect fluorescent antibody test that is used to detect and identify specific serotypes of the disease.
That would be correct. And back to you, Luke.
Let's do diagnosis for 800, please.
All right, for 800. What drug should not be taken to treat dengue fever? Forrest.
Aspirin and non-steroidal anti-inflammatory drugs such as ibuprofen should be avoided because of their anticoagulant properties, as these can increase the bleeding caused by DHF.
That would be correct. All right, and Forrest, back to you.
Diagnosis for 1,000.
All right, diagnosis for 1,000. Since there are no antiviral medications, how do you treat dengue fever? Forrest.
You use analgesics with acetaminophen to reduce pain and fever, and you use fluids and electrolytes, either oral and IV, and getting plenty of bed rest helps treat dengue as well.
That would be correct. All right, moving on to our last category. Luke?
Let's do prevention for 200, please.
For 200, what is the primary form of prevention?
Eliminating where the mosquitoes lay their eggs.
That would be correct. Alright, and Forrest?
400.
Prevention for 400. Where do mosquitoes lay their eggs? Forrest?
In stagnant bodies of water like ponds and especially artificial water containers such as pet water bowls and 55-gallon drums.
That would be correct. And Luke?
Let's do 600, please.
Prevention for 600. What modifications can you make to your house to prevent this disease? Luke?
You can use screens in your windows and doors, as well as eliminating the artificial water containers that they lay their eggs in.
That would be correct. And back to you, Forrest.
Let's go 800.
Prevention for 800. What can you do to protect yourself from contracting this disease? Forrest?
You can wear long sleeve shirts, pants that are tucked into socks, and you should use mosquito repellent that contains DEET.
That would be correct. Alright, the buzzer means that time is up. Scores are close. Now it all comes down to our final bonus question. The category is vaccine prevention. Before we get to the question, let's hear from our sponsors first.
Tonight's show is sponsored by Diet Dr. Pepper, the official beverage of Hot Rod Anderson and microbiology experts everywhere. We are also sponsored by Kleenex, the tissue brand best suited to soak up the tears caused by med-micro studying. Don't let tears stain your notes. Use Kleenex.
Welcome back. Contestants, please write down your wagers. Alright, contestants, hold up your answers. I'm sorry, both those are incorrect. And there is no vaccine to prevent dengue fever. Well, that ends our game of So You Think You Know Med-Micro. Tonight, as usual, nobody won. Tune in tomorrow to see if our next batch of contestants can walk out as big winners.